I'm kind of pissed off in this regard because I just got a rude letter from one of the big insurance companies saying, you are in the 95th percentile of people ordering D3, D tests, D blood tests, and you're ordering too many and we should. It just pisses me off so much that insurance companies regulate or try to regulate what I as a doctor am doing. So here are the facts. Yes, I order D levels, vitamin D3 levels on almost all of my patients when I do blood work, and I am blood work intensive. So they are correct. I am way out there in terms of ordering vitamin D levels. So the question is, why do I do it? First of all, I work in a world of insulin resistance, and we're going to talk about this in a second, but insulin resistance is the primary cause of D3 abnormalities, vitamin D abnormalities. Okay, we'll talk about that in a second. However, the second thing is this, by far, the single most important abnormal number in all the blood work that we do are vitamin D levels. And vitamin D is so important as a primary vitamin to assist in so many parts of our metabolic function. And by far the most common vitamin supplement that my patients are taking is a vitamin D supplement. So of course we should be looking at these numbers, and most often that is the number that can easily be corrected by me by recommendation to say, hey, your number is low, take this medication. And it is even more important as we in the Northern Hemisphere are starting to go through winter, where we don't get out in the sun as much, we don't get as much sunlight, the UV light is slightly down, and that UV light is essential to the conversion, the creation of vitamin D in our skin from ultraviolet, from sunlight. So particularly at this time, I would tell you out there, it is essential, it is important to know what your vitamin D level is. And if you're interested in finding out, come to me, because I'm going to continue to order it because we treat it and we see the deficiencies. And the insurance companies, if they want to tell me not to order it, they've got to understand that they are forcing me to practice less good healthcare to save them money.